at your cervical and usually your first 2 or 3, 4 thoracic, and then for lower, come in here, arms over their shoulders, and just push it down through. And I usually try to bring them back to me, so I'll lock out their lumbar there, so it's true thoracic. Just doing that right there.
Wouldn't that one be more accurate to stick with that so you don't get all the cervical triangulation?
It's hard because you're coming here. I'm really missing those first 2 ribs.
Okay.
So
That's the biggest.
the cervical, most of your first 2 thoracic are really function as additional cervical vertebrae more than anything. They behave a lot more like the cervical vertebrae. So you could, if they're having a lot of neck pain and stuff, I'm probably not going to do that. But just because you come out here and you're on their shoulders, you may miss that first rib really, first and second one. So because you're maybe going to get down through there, so you're going to get 3 through 12 below. Contraction, I usually do that. Contraction to unload the upper thoracic, and then arms across, lift it up to get that traction. I don't use a lot of traction in the thoracic spine much. You can try that, some people do. I just don't use it that much. It's not that beneficial to me. There's no way I'm gonna really put them in a good traction environment for thoracic. You get 10 through 12 maybe with your lumbar, and T1, T2 with your cervical traction. You put a little weight through it, but the rest of it's not gonna be a lot. There's not a lot you can do with that. All right, we got central and unilateral PAs. We need to review central and unilateral PAs. So it's basically pain provocation. It's your arthrokinematics. So it's your glides, like you do for the shoulder, is a posterior glide. You got an anterior glide, inferior glide. Basically, that's what you do with PAs. It's just a posterior anterior glide. Pain provocation, looking for, does this cause your, reproduce your symptoms? Do you have pain with that motion, and is it stiff? Questions you're really asking those. So just look at, you really got to look at central PAs right over the spinous process. You got your facets about less than a thumb out. You also got a costotransverse joint out here also. Don't use a lot of PAs because that's pretty, unilateral PAs are pretty stiff in the thoracic spine because you got an overlap of the rib and transverse process. That you can find pain provocation there quite often. So that's, I don't know, I think most, I don't know if anybody's used any central unilateral PAs as much as success.
Sometimes use the unilateral PA for dysfunction, but it's more out on the costotransverse, and my claim is in the rib kind of laterally.
Yeah.
But I don't, not the ones that we really learn from straight PA.
Yeah. I tend to do like you said, more rib springing, costotransverse type stuff with stuff. So let's look at that. So central and unilateral PAs there. Okay, for I'll show it on the spine first. For rib springing, I'm going to take my make sure it says it right on here. Yeah. So I take my right hand. I'm going to put it right over these. I use put my little finger in this groove here, and then most of my hand over the transverse processes on the left side over here. So look like that, just to stabilize. So then I want to pull here. Take my other hand and just, while stabilizing here, springing there. I usually spring in groups of 3 or 4. There. So get most of the lower ribs this way. So the arm's going to be out. Open up that specific area that I think it's hypomobile. I'm just gonna turn my hand just a little bit, and then follow the rib angles. You gotta get your, typically they're gonna be going down. Some people have a little more angle than others, so you gotta find that rib angle. And I can just bring right over it, same thing. Okay. Questions there? See that over here? Over here. Switch it, so right there, let's stabilize there. This hand to spring. Following those main rib angles. Right there in the mid. Mid and lower we do that way. Now switch hands if I need to. Just get individual ribs. Like that. Okay. So upper. Really try to open up those arms so you can get to these ribs here. So we were here, so now I'm going to switch it. So here, and now we get in between those spinous process of the scap there. I'm going to spring here. So do the same thing with this hand pointing down, springing there.
Do you need them to protract to get the scapula out of the way?
Yeah, try as much as you can. It's going to be a tough one because some people have a lot of protraction and really can pull those scapula apart. But there's others that are small. If you're small-brained, it's just not a lot of space there. So that's when you can kind of come in and sometimes we'll just use the thumb to kind of follow along those ribs a little bit, or smaller hand. Just have to adapt to their body. So, okay, so over here we were. Okay, so we were there. Now we're going to. There. So we're going to switch. There. Try to go right there. So follow those rib angles. So you know, upper 3 or 4 be slightly down and quite more straight out from the spinous process. As you go down, they start sloping more and more and more. So make sure you're on the rib angles appropriately. So get a little higher right there. Try to get your hand in there. Thumb, wherever you find.
Can you get specific with the upper ribs?
Yes.
How do you do that?
I just try to put my thumb in there usually what I'm mobilized with, and put my finger like that, so I can take my thumb a little bit and just do, it's almost like a PA. Depends on the person.